my name is Ashley Johnson, and today we're going to discuss why physician-assisted suicide should be legal for terminally ill patients. So let's start with, how do you want to die? For me, it's quietly sleeping in a bed well into my 80s. But for any of you that have had a terminally ill family member or friend, you know that this way of dying peacefully is out of their reach. For these unfortunate people, there's no prospect for improvement, and death is an excruciating, lengthy process. Terminally ill patients should have the choice to end their suffering and the suffering of the loved ones watching as they deteriorate. There are two terms used frequently when referring to this subject: euthanasia and physician-assisted suicide. They are very slightly different, but the difference is vital. Euthanasia is the act of deliberately ending a person's life to relieve suffering, and assisted suicide is the act of deliberately assisting or encouraging another person to kill themselves, according to a 2014 article, Euthanasia and Assisted Suicide, by NHS Choices website. With euthanasia, a person or animal is being put directly to death by another being, such as when putting down your family pet. Most often when euthanasia is used, the patient has no say. This is not the goal of physician-assisted suicide. There are two categories of euthanasia. Active euthanasia describes situations when the patient, a medical professional, or other designated person intentionally carries out an act that directly causes death. For example, injecting a lethal dose of opiate painkillers to someone on death row. Passive euthanasia refers to death caused by withdrawing medical intervention that keeps a patient alive, according to the editors of Access Science 2016 web article, Euthanasia. This is what is commonly referred to as pulling the plug, where you remove all ventilators and all machines and you just let a person die naturally. That can take hours to days to weeks for some people. Passive euthanasia is legal in the United States. However, active euthanasia remains illegal in most states. Physician-assisted suicide is when a physician or otherwise licensed professional provides a prescription, usually barbiturates, to cause intentional overdose upon a mentally sound patient's written request. So you may find yourself asking how physician-assisted suicide is different from euthanasia. Physician-assisted suicide allows a terminally ill patient to choose to continue to suffer or not. No one else can make this decision for them. In states where assisted suicide has been legalized, there are protocols in place to ensure a patient's own desire to die and that they are uninfluenced by doctors or other individuals. Oregon has set the standard, and the Oregon law requires a patient diagnosed as terminally ill to make a written request for medication for the purpose of ending his or her life in a humane and dignified manner. The request has to be witnessed by two people, one of who is not related to the person or entitled to any part of their estate, the other a doctor. The request has to be made in the presence of a doctor, according to John Frank, author of the 2016 article, Physician-Assisted Suicide, Up for Debate. Here we can see a map of the United States. The states in blue are the states that have legalized physician-assisted suicide. The states that are in the lighter orange color are states that are currently debating whether they have legislature in place and their houses are currently debating if it should be legalized. So the four states that have right to die laws are California, Oregon, Washington, and Vermont. Terminally ill patients will find a means to die if they wish to. Assisted suicide is the most humane way to fulfill their wishes. Terminally ill patients in states where assisted suicide is illegal are using other means to cause their own deaths anyway. Some of these ways are to voluntarily stop eating or drinking, stop treatment or not start treatment at all, or use palliative sedation as mentioned by Death and Dignity in their web-based frequently asked questions. Palliative sedation is the use of sedatives to induce a deep sleep or coma and often speed up deaths in patients experiencing extreme suffering when there is no effective treatment. Other passive suicide methods are already widely used, such as do not resuscitate orders or written requests that if someone's heart is to stop, they are not allowed to restart it. They are not supposed to do any measures to try and revive the person. These methods draw out the time it takes for a person to pass and often induce more pain and suffering than is necessary. Physicians most commonly prescribe barbiturates when the request is made in states where assisted suicide is already legal. The effects of barbiturates can begin as early as 15 minutes after ingestion. The initial symptoms are sedation, then nervous system depression, underventilation, hypotension, hypothermia, which may progress to pulmonary edema and death. According to 2009 web article, Seconal Sodium Overdose by RX List. In simpler terms, this means the patient will first fall asleep, their breathing and their heart rate will slow, their body temperature will drop, and progressively they will develop fluid in their lungs and they will pass peacefully while they sleep. You should be pro-right to die for the following reasons. In states where assisted suicide is legal, doctors and other medical professionals who oppose assisted suicide hold the right to pass the case to another physician. Therefore, there's no guilt on the physician. They do not have to fulfill the wishes, they just have to pass the case to a doctor who's willing to. Ethically, everyone should have the right to choose to do what they want with their own bodies, whether that's alive or in death. For any person who opposes physician-assisted suicide for religious beliefs, should remember that many people have different beliefs than them, and these patients are choosing what they want to do with their own bodies. They are in no way harming you, so let them choose. Physician-assisted suicide is more humane for the terminally ill than starving themselves or waiting for a slow and painful disease to kill them. So, the Oregon Department of Health provided us with some interesting information, and in 2012, 77 people died under the Oregon Death with Dignity Act. So a lot of people think that, well, all these people are going to request meds to die, it's going to be overwhelming. Well, that's not true. Only 0.2% of Oregon deaths in 1 year were from physician-assisted suicide. So in conclusion, physician-assisted suicide allows terminally ill patients an opportunity to end their suffering in a humane and dignified way. It restores a sense of choice to many who have lost theirs due to an illness. Take a moment and imagine if it was you or a dear loved one in chronic extreme pain. You know it will be this way or worse for the rest of your life, until you finally die a slow, traumatic death. Would you want your parents, your children, your husband, or your wife to watch you die slowly, or even possibly be responsible for your care? I know that I would never want to put that responsibility on my family, and that's why I believe physician-assisted suicide should be legalized in the United States.